Hello, it's Dr. Peter Balogh to give you some tips as far as what can you do to help stabilize your loose dentures. I talked in a previous blog about some of the pitfalls of dentures and why you want to try to avoid them if at all possible, or try to keep some teeth to help stabilize them. But let's say you've already lost all your teeth and now you've got these dentures and unfortunately they're moving around. There's not a lot that you can do that's simple. There's a few things that can be done. The biggest problem with dentures is, and here's an upper denture, is what holds them in place is how well it fits to the gums. Secondly is the shape of the gums and how good the ridge is. If you've got a good tall ridge, then the denture has got something nice and solid to hold on to. But if the ridge is already gone, if the ridge is flat, then it makes it much more difficult. Sometimes making these a little bit longer in the back will give you a little more suction, so that's sometimes possible, but it starts to affect our swallowing and our gagging sometimes, so that can be a limitation. If you do have a good fitting denture and it's as long as possible, and the denture is fitting well, it's been relined and all those sorts of things, about all you can really do from a simple point of view is use a little bit of denture adhesive. Not the greatest stuff, it's really yucky, it's messy. Patients who have used it tell me that it affects the taste of their food, but you just need not too much, just a few dabs, maybe 1, 2, 3, 4, about 5 dabs around the arch, and the same thing on a lower, about 1, 2, 3, 4, 5 little dabs, pea-sized bits, and that can help hold it in place. Problem, once again, if you drink something hot like tea or coffee, it softens it up, it melts it, and then all of a sudden the dentures start moving around again. This unfortunately gets worse as time goes on. The longer we've had dentures, the more troubles we have. When we first get dentures, usually we have a reasonably good ridge. Just to give you an idea, this is a sample of a lower jaw with, you can see how much bone there is when the teeth are in place. As soon as the teeth are removed, you lose quite a bit, and as time goes on, you get less and less bone to the point where it's almost no bone at all. And in the mouth, what you're seeing is less and less of a ridge, and especially you get to the point where in this end you have pretty much a flat surface. And so these dentures start to slide around like a hockey puck on ice. Beyond that, all you can really look at doing is considering some implants. And of course, implants are fantastic, they're wonderful, there's lots of things that you can do with it. Here's a denture that's held with some implants. If I take it off, there's a model showing basically a couple implants with some attachments, and on the undersurface of the denture there's something that snaps into these, and at least, and I'm not sure if you can hear that click, that keeps the denture secure, keeps it from moving around. And of course there's lots of other things. Of course we can even go to the point where we get permanent teeth that don't come out. But that's the next simplest thing as far as retaining your dentures, besides trying to get as good a fit a denture as possible, and of course using some denture adhesive. If there's any other questions that you have, you can always write to us at www.vccid.com. Thank you.